Hello, attractive mindset strategist. Oh, I know who you are. Hey, thanks for joining. Let's see. I'm going to wait a minute here. Hi, hi. Hi. It's great to see you here. All right, so I'm going to get started. I keep these things short, and this week we're talking about weight loss after 40 or weight loss after 50. And I just put a post on LinkedIn because I ran across an article in my feed that was interesting, and I'm going to talk about that in a minute here. But let's see here. Okay, there we go. So yesterday we started talking about the myths that in the perceptions that people have about weight loss after 40. And so we're just running through some of that information. And we talked about like the main myths that I encounter people talking about are things like they're going by the scale instead of their body composition. They're going by, they're thinking that if they do more aerobic exercise, like when they were 20, that will burn more fat, but it usually ends up doing the opposite when people are over 40. They're also thinking that if they do more intermittent fasting or more fasting, that may help. But that can also make things worse with the metabolism. So you can look at the recording from yesterday, and there was some good information there. And then we started rolling through some of these causes of menopausal weight gain. So I'm going to start today with diabetes. We'll see how far we get. And diabetes, or a lot of people don't realize that they're on the spectrum of diabetes when they're having trouble losing weight. And it could be insulin resistance. And there's certain labs that you would need to have done in order for us to be able to see if you have insulin resistance. And it's not just the A1C, we have a number of labs that we look at. And then some people don't realize, like if you have high blood pressure, if you have elevated LDL cholesterol or elevated triglycerides, those are signs that you have insulin resistance. People are taught to think by conventional medicine that these issues are, that it's some kind of separate issue. Like if you have high blood pressure, you need to go see the cardiologist. Well, many cardiologists are just going to give you a high blood pressure medication. They might do an EKG, but they're not going to really look at insulin resistance, which is probably 90% of the people walking around with high blood pressure probably have insulin resistance. Insulin resistance will keep you from burning fat. As you get older, it's harder to metabolize so many carbohydrates, fats, even proteins later in the day. So a lot of people go by, when the sun is going down, you should have had your last meal of the day in order to give your body 2 or 3 hours to metabolize the food. So I'm not going to beat that dead horse, but let's see here. So we actually, in a program that I am partnering with a naturopathic doctor, Dr. Sanza, are using devices to measure the metabolism. So we're not guessing, we do lab work, and we also coach our members on looking at metabolism devices for It's an element of artificial intelligence because it's measuring the metabolism at different times of the day. It could be before activity, after, it could be first thing in the morning, to see, over a number of days, like what's going on and what's happening with the metabolism. It gives us a lot more data to work with. So the next thing, and I didn't even mention, I mentioned the cardiologist with the insulin resistance, but more and more cardiology is starting to tune into functional medicine and integrative medicine and looking at root causes. It's not what they used to say in the past. They used to have people scared of eating butter and eating eggs, and that's really not it. Heart disease, cancer, just about every chronic disease you can think of are driven by chronic inflammation. So that is what we should be thinking of with weight gain. And a lot of people that have weight gain in menopause or after 40 or after 50 or after 60, many of them have heart disease developing. So there are markers that we look for in our blood work for that too. But typically, you would have to go to your primary care doctor and have your own research and know what to look for because they are not trained in looking for a root cause. So especially when it comes to preventing chronic disease. Okay. So that's a repeat of, I'm sorry about that, a repeat of the same slide, but this is a new slide here. And toxicity. So a major reason that kind of goes unchecked why people have weight gain is because they have toxicity. And I know all of you that are on here are probably aware of these different mechanisms of toxicity. I would say one of the top things that we see are the heavy metals. And the heavy metals are everywhere. They're in the water, they're in the food, they're very concentrated in animal fats, and they tend to concentrate in our fat as well. So you can start to see more heavy metals like in your tissues when you lose weight because the body will break down the fat and the fat is generally where it's stored. Pesticides like glyphosates can cause weight gain by different mechanisms. And fake foods are things like high fructose corn syrup, like things that create these so-called foods that are not really foods that they sell to us as foods. So a lot of it is junk and you have to learn how to read labels. Poor water quality, I'm sure you heard about the PFAS controversy today, brought up by, I think the EPA and the FDA are about to try to get these jurisdictions to start monitoring for these types of chemicals in the water. They are in the water, they're everywhere, and they come from everything. They're even like medical devices that have PFAS. So PFAS are chemicals that accumulate and they don't get broken down in the environment, and our bodies can't break them down either. And when they accumulate, they cause cancers of different types. They don't even know all the downstream effects. We know some from studies, but not a good thing. And they're going to have to do way more than address the water quality. Environmental and household chemicals. So there are a lot of chemicals in the things that we use in our household. So we need to be using, natural substances to clean in the house. And also in the environment, there's a lot of chemicals like we were talking about, PFAS, there PVCs, there's all kinds of things in the groundwater, all kinds of things in the soil. So it's really imperative to pay attention to your food, where your food is grown. If you're buying packaged food, you need to know what additives are in there. You need to start learning how to read labels. Cosmetics and personal care chemicals such as hair dyes, just all the things that women use, like shampoos and conditioners and hair products, skin care, lotions and oils, all that stuff gets absorbed by the skin, the scalp, and people just don't pay attention to it. I would encourage you that if you go to Europe, if you go to like a pharmacy or a drugstore when you're in like Spain or one of the EU countries, go and read the labels and compare it to, if you take some of your products with you, compare it to the label. And you can look this up online, but it's extreme in the United States. We just don't have any regulation. You can look at Environmental Work Group and get an idea of what's going on there. This is not an exhaustive list, but these are some of the top things that I've seen clinically. So also weight gain can come about because of deficiencies. So many people don't realize if they're taking medications, I mean, the average American takes 3 to 7 medications a day. They could be over-the-counter medications, they could be prescribed, or they could be combined. Guess what, you guys? Dr. Sanza just joined, and she's the one that I am partnering with in the BU to the Fullness program. Hopefully I'll have a link for you guys for tomorrow. We're going to be doing a masterclass. We just talked about it today on March the 28th. So if you're interested in joining that, hopefully tomorrow I'll have a link for you to sign up for. That's going to be a masterclass. It'll be on March the 28th, and it'll be at 12 noon. All right, so thanks for joining, Dr. Sanza. So deficiencies, if you're taking medications automatically cause vitamin and mineral deficiencies. And there are lists where you can look this up. You can look this up online. For weight loss, we're particularly concerned about the B vitamins, like B6, B12, thiamine, because you need B vitamins to be able to metabolize fats, to metabolize carbohydrates. So obviously, if you're trying to lose weight, you need to be able to burn carbohydrates efficiently. And some common mineral deficiencies that we can see are magnesium. In order to, for carbohydrate metabolism also, you need chromium. And a lot of times when people are insulin resistant or have diabetes, they have chromium deficiency. Selenium is a common deficiency that we see in people that have kind of autoimmune issues. And there are more. This is just some that are at the top. And it can be hard to convince your primary care doctor to do some of these, because these are some that it's likely your insurance is not going to pay for. And your doctor does not want to deal with your whining and crying if your lab that they send you to, if it doesn't get approved by your insurance, the lab is going to pass that bill on to you. And you could end up paying quite a bit of money if you have gone through the process of getting it approved by insurance. So it's best to go through doctors like me and Dr. Sanza to get wholesale prices, and we're able to offer labs at a much lower price. Sometimes you're able to find things online that provide the same thing, but I would say you need to go to a good source of buying these labs, just like you're shopping for, the best deals on things that you buy every day. You can shop for labs and see what you can find. So I talked about heart disease just a little minute ago, but also high blood pressure can be an issue. And, all the things that we've talked about so far today, like insulin resistance, diabetes, heart disease, high blood pressure. They are all kind of related to insulin resistance and those deficiencies that I was just talking about. And I talked about that, you know, these are things that can result from the process of like weight gain and toxins coming out of the body fat when you start losing weight can also contribute to some of this. But most times it's deficiencies and toxicities and poor lifestyle. So another thing that we commonly see, like if someone has blood pressure that's poorly controlled, a lot of times we're seeing sleep issues. So if you decide to come and join us, we will be asking a lot of questions about your sleep issues. And the sleep issues can stop you from losing weight and they can cause you to have high blood pressure. So it's important to address the sleep issues because that's a root cause. And if you're not addressing the root cause, you're not going to lose weight. Okay. All right, so I'm going to talk about this tomorrow, and I'm sorry I started like a couple minutes late. It looks like I've gone over for about 5 minutes over what I am supposed to do today. I think I got a lot in today, so I hope you can join tomorrow. And I'm so happy that Dr. Sanzo was able to join us today, and hopefully I'll have a link to share with you tomorrow. Or talk about the program a little bit more tomorrow, okay? And do any of you have any questions today? I'm happy to answer your question. Thanks, Dr. Sanza. Pulse neurofeedback. Hi, I haven't seen you here before. Thanks for joining. And Cinderella Taylor, thank you for joining. Great to see a couple of new people here today. We had a good crowd here today. Thanks, Dee. Thanks for joining again. I love getting feedback from you, so thank you very much. Thank you so much. All right, all right. Well, it looks like nobody has a question today, and I've run my mouth enough today, so I'll see you guys tomorrow at 6:30 for the last day of the challenge of this month. And okay, you see why you can't lose your last 5 pounds. Yeah, those last 5, you know, I need to put up a before and after picture of myself, but I've been working on losing weight for ever since probably my 30s. I've been like every decade I had to ratchet it up. So, but these most recent years, I seem to have gotten it under control and I'm almost near my goal, but I keep bouncing around the 2 or 3 pounds mark. So I'll see, you know, I need to do more often body composition myself. I have access to a machine, so I need to get my body composition. The more muscle mass you have, the more you're going to burn fat. So it's working. It does work. All right. All right. So thank you for joining today. Bye-bye.